You say you're doing something different. I'm not playing at all. You're not playing different opening.
I am, but you can play it once I'm done.
Encouraging, educating, and empowering you into action. This is Warriors Talk with your host, Lady ReShell.
Hello. Welcome to Warriors Talk with author and founder Lady ReShell, where we move away from awareness towards action. It's Health and Wellness Monday, and our topic for today is cervical cancer, what every woman needs to know. We are live on Intellectual Radio. We just heard from The Drive at 5 with Roman. Keep it locked right here on Intellectual Radio and allow us to feed your brain. On the last episode of Warriors Talk, I spoke with breast cancer survivor Patricia Dangerfield, and she spoke about finding purpose in the storm. Head on over to YouTube and type in Intellectual Radio. Stay connected for any episodes you may have missed. The quote of the day is, difficult roads can lead to beautiful destinations. Here is your trending topic for today. According to CBS News, a woman was found stumped and robbed on the CTA Red Line earlier this month, died over the weekend. CTA employees found Vivian Morgan, 61, unresponsive and lying across the seat on a train car about 1:30 a.m. on January 4th near the Roosevelt station. Morgan was taken to Stroger's Hospital in critical condition, but pronounced dead at 7:15 a.m. on Saturday. An autopsy Sunday was inconclusive and pending further studies, according to the medical examiner's office. The suspect in custody, Johnson, 13, was charged with attempted murder, aggravated battery, and a misdemeanor count violating an order of protection, police said. A Cook County judge ordered Johnson to be detained. A spokesperson for Cook County's state's attorney's office did not have an immediately comment, but they said that charges were expected to be upgraded. Court documents say Johnson was one of the two suspects on the train who tried to steal Morgan's bag. Johnson allegedly held her head on the train seat while he punched her in the abdomen, in the head, and stumped her on her body, leaving her brain dead, according to documents. Morgan suffered cuts and bruises on her face, a broken rib, and trauma to her body, according to police. That is your trending topic for today. I would say please say a prayer for Morgan's family, because people use the trains every day to go back and forth to work, and you want to be safe while you're on there. You don't want to have to be fighting for your life every day.
Amen to that.
We have a special guest on today. She is our healthy solution expert with over 20 years experience as a family physician, and she's impacting lives every day. She has been educating listeners with her wisdom and her experience here on Warriors Talk since 2019. Welcome back to Warriors Talk, Doc Michelle. Hey, Doc.
Hello. How are you today?
Good. Happy New Year.
I know. Happy New Year. We haven't been able to really connect. The holidays were just hectic and busy, so we didn't do the show then, but here we are. So good. I'm glad to be back.
Yes, happy to see you. You look great. You're glowing.
Oh, thank you.
Yes. So I'm excited about the show today because I know that the information today, I think sometimes we forget about different types of cancers, because we hear about breast cancer all the time, and it seems like breast cancer gets all the spotlight when it comes to advertising and pushing out awareness. But this particular cancer is very important as well. Number one, because it's preventable. And so we want to make sure that we give out some information to individuals today so that you can take action with what you learn on today. So we're talking about cervical cancer, and this is everything that women need to know. So like, share the show, invite someone else in on the show that you feel may benefit from this valuable information. So we're talking about cervical cancer, Dr. Michelle. I know that according to the American Cancer Society, they say that in the United States in 2024, about 13,820 cases, new cases that is, of invasive cervical cancer will be diagnosed. And out of that, 4,360 will die from this disease that they don't have to.
Yes, thanks for starting with those statistics, right? Because as you said, cervical cancer is not as prevalent as breast cancer, lung cancer, and those other ones that are unfortunately killing millions of people every year. But any death is one death too soon, especially when we have ways to prevent, treat, and cure cervical cancer. As you said, close to 14,000 new cases were in 2023. Over 4,000 deaths in 2023. Yes, when we compare it to breast cancer and those other cancers, it's not as prevalent, but it's so important to have the conversation, because I know we'll talk about it here today. What can we do to prevent it? How do we catch it early? And how do we treat it?
Yes, when you think about cervical cancer, there's so many different, I want to say, misconceptions that are out there about cervical cancer. So I think this is an important show to kind of dispel some of those myths as well when it comes to cervical cancer.
Yes, yes. And it is, any woman can get cervical cancer. So let's start with, what it is, what the risks are. So we know that the HPV virus is the primary cause of cervical cancer. We know the HPV virus, like most viruses, have many, many different strains of that virus. Some are more high risk to cause cancer, and some are lower risk. But what was developed years ago, I want to say, the vaccine Gardasil and the HPV vaccine, it's been over 20 or 30 years we've had that vaccine, that it helps to prevent you from getting the most high-risk HPV types. And we recommend that young tweens and teens, starting at age 11, for boys and girls, get vaccinated, because we know that if we can prevent someone from getting that HPV virus, first thing is we can prevent them from ever getting cervical cancer. And I've always said to patients and teens that no one should really ever get cervical cancer, and no one should certainly die from cervical cancer, considering all the things we have to prevent it and treat it.
I totally agree. This is one of those things. I think about colon cancer too, where you have the screening that can actually prevent it. The doctor can go in and move polyps that can prevent them from turning into cancer. So that's a preventable thing and an action that we can take and we can do. And we know that that's not true for all cancers. So when you have something in place that can prevent it and help you, I would say take advantage of it.
Yeah, and the HPV virus, it can be transmitted during sex, vaginal, anal, oral sex. And so anyone, again, we're trying to catch tweens and teens even before they become sexually active, because we know that the older we get, 80 to 90% of women probably have been exposed to HPV and living with the HPV virus by the time they're 50. And so the idea is to catch it early so that you never get it. But yes, at least half of sexually active people will have HPV sometime in their lives, and 8 out of 10 women have had it at some point.
So this is a sexually transmitted disease?
It's a sexually transmitted disease, sexually transmitted virus, that two things. It can go away on its own and never cause a problem for someone. It can sort of hang around and cause something like genital warts, bumps and lumps in the vaginal anal area, or it can progress to cervical cancer. And I don't know, we'll talk about getting screened with your pap exam and your HPV testing that can be done when you have a gynecological exam.
I know from my two teenagers, I remember getting the one shot. It's so hard to do the follow-up because it's like 6 months down the line and then I forget and
I know.
they
A
don't
lot of people
remind me.
do.
Yeah, and that's just like, oh, so
Yeah.
I think I don't even know how to, I guess, put it on your calendar that the doctors can kind of follow up with you to make sure that you get the 6 months. Because if you miss it, then you have to start over, right?
Yes, yes. And so if your doctor should remind you, I will tell you to put it in your calendar because we forget, right? That what's going to happen 6 months from now. We do. But we want to make sure that you are fully vaccinated, that someone is fully vaccinated to get the full protection of
Now,
that.
is it just two shots?
It's two. They say if you are between the age of 16 to 26, sometimes they recommend 3 vaccines within a year, depending on your risks level. Right now, vaccinations are recommended up until age 26. And that's because they think probably by age 26, you may have already been exposed to HPV. In some higher risk populations, they will recommend the HPV vaccine up until age 45, right? If you have multiple partners, if you're in high risk behaviors, things like that, they may still recommend that you have it.
Awesome. I just want to say hi to some of the ladies that are tuning in. We have Kenya, we have Lisa, and we have Paula. Thank you guys for tuning in today. Make sure you share the show out so someone else can get this information. I want to go into symptoms before we go into like treatment and risk factors because some people may not know that they have cervical cancer or they have this HPV that causes it. So, we're just going about our life and thinking like everything's okay. And then in the background, this thing is lurking, it's growing.
Yes. So, first of all, with HPV itself, sometimes you have no symptoms. We talked about that, right? You have no symptoms. Sometimes you might notice a genital wart. But if you have HPV that is continuing to cause infection and inflammation in the cervical area, then you may have symptoms such as irregular vaginal bleeding, bleeding in between your usual cycles, vaginal bleeding after sexual activity, painful sexual activity. Those type of things might lead you to be concerned, right? At any time you have bleeding after menopause, postmenopausal bleeding, when a doctor hears that, if you have not had a period for 12 months and all of a sudden you're having a period, please go and talk to your provider because we need to check you for not only cervical cancer, uterine cancer as well. And yes, but
if they have
bleeding between your periods. Go ahead.
Periods are longer or really heavy. I've heard people say, "Oh, they flow. It's like really heavy." I'm like, that's I don't think that's normal. Like it shouldn't.
Yeah. So heavy vaginal bleeding. That's a whole nother topic, right? Because that could be from fibroids, which can be very prominent in African American women. So we should have a show about that. But some women just have heavy, painful cycles. It could be endometriosis. It could be normal. It could be fibroids. It could be cervical cancer. So certainly on the differential of what it could be normal or it could be really important, right? If you're having, an odor, lots of spotting, anything like that, you're noticing some blood, that again, intermittently, get that checked out.
Did we say pain during sex?
Yes, pain during sex as well, right? Because if you've got inflammation on the cervix, if you have a sore there, you're not going to see it, but you may feel pain.
Bleeding after sex, you shouldn't, especially
you should not be. Yep, same thing. If you're having painful sexual sex, if you're having bleeding, if you feel like, oh, that is bringing on my cycle when it's not cycle time, get that checked out for sure.
So if you're having it, I would say if it happens just one time, then you're not concerned. But if it's happening
repeatedly, yes,
then you should be bringing it to the attention of your doctor to say, hey, something's not right, something's off.
Yeah, and postmenopausal, getting back to that, right, as well, right? So you might have postcoital bleeding if you're postmenopausal because the vaginal lining might be thin, it could be fragile, you may have some spotting, but you still want to get that treated because there are things we can do for that, right? We have vaginal estrogen and other options. So
right. I know for me, like with the chemo, my cycle was coming like once a year until I hit 51, which was kind of weird because I was diagnosed at 43. So then the month that I started the chemo, it would come every year on that month until I got into menopause at 51, and then it stopped. So I was just like, that's kind of weird, but
yeah. And chemotherapy does that, right? It changes your whole system, your whole body, affects your hormones, and so everything can go when you start chemo, right? Anything can change and everything changes. And so it's important to have good conversations with your provider when that's happening.
I recently I had a tooth infection in my tooth. I had a toothache. I'll call my dentist like, hey, he said, okay, I'm gonna give you some antibiotics. Well, I used to be able to take the antibiotics. I took the antibiotics to get rid of the infection. I got violently ill from the antibiotics. And I'm just like, what is going on? I said, okay, after chemo, my immune system is totally different. So I can't take those anymore. And I was just like, oh my goodness. Like my body used to be able to take it, get through it, and no.
Right. Because the chemo could have even changed the good bacteria in your gut, in your system. And so when you take antibiotics, that throws everything off. I always tell people when they're on antibiotics, take some probiotics, eat yogurt if you can, so you help keep your good bacteria available to fight off those type of symptoms.
Okay. Now I know that. See, I didn't know that at first. Otherwise, I probably would have done that. Yeah. But yeah, so now I mean, this is after 10 years, and I'm just now finding that out. So yeah, I thought that was really horrible. So we know that when you first, cervical cancer is happening at first, it may be quiet. You may not have any symptoms at all. So you may not be alarmed that something may be going on. But then once it starts to progress, then you start having these symptoms that you really cannot ignore.
Right. Yes, because it will tend to grow and a couple of things can happen. You can have more abdominal pain in general because there's more mass and tissue pressing on things. Some people will have constipation if there's, again, that mass pressing on your colon. And all of those things. You could even have urinary symptoms because of how the uterus sits on top of your bladder, and any bacteria and infection and inflammation can be passed into the urine. So again, you can't ignore those things. Yeah, dull backache because of how, if some you'll hear doctors talk about you have a tipped uterus and things like that. So depending on how your uterus is tipped and where that cervical mass is, when you have advanced cancer, it may give you a dull backache. That is something that is different. I always tell folks that even not with cancer, but anything, right? If things are different and they are persistent, you should go and see a physician, discuss it, get some, testing done, and go from there.
Well, I mean, some of those symptoms can be
anything.
So it's just like, go to the doctor and get evaluated so that you can rule out certain things and they can narrow it down to those things. Sometimes, I don't know, for some people, sometimes it may take them a while, a couple of visits before they can really diagnose what's going on. So it's important for you to write down any type of symptoms that you're having, email the doctor, so that they can, be alarmed as to what's going on. And then maybe they could look up some stuff before you get in the office, so that, you can find out what's going on. Because it may, especially some people they may be embarrassed. They may, be ashamed about, oh, is something going on down there, and I don't really want to say what's happening. So they may not be forthcoming with all of everything that's happening.
Yeah. That is very true, right? Some people don't really want to talk about the gynecological concerns, especially if they're not feeling comfortable with their provider. And again, they might think, it's nothing. It just happened at one time, but it's not a big deal, right? Okay, maybe I have some spotting, but it's not a big deal. It's not affecting what I need to do in life and day. And so it's important for your provider, for us, to be asking the right questions, right? Those gynae questions, when was your last PAP question, because that's something that sometimes as women we might let go, and not get it as regularly as we should. And speaking of that, right, so we normally will start PAP exams when a woman becomes sexually active, or 21. Okay, so whichever comes first, right? If you've not been sexually active, we would say at age 21, you get your first PAP exam. And if nothing really changes, you don't need a PAP exam every year, right? If you're not sexually active or you don't have a new partner or anything like that. But if you're sexually active before age 21, your provider will do a PAP exam. They'll probably do that HPV test to make sure that that's good. And then depending on your history and risk, they'll talk to you about how often you should be getting a PAP. Probably at least once a year if you're sexually active, have different partners and things like that.
The last time I went for my annual, I think they did a PAP smear maybe a couple of years ago. And I guess because it was normal, they said, no, you don't need to get one this year. And I'm just like, and it kind of freaked me out because I'm like, why? Like, I don't know. I would rather have it than not have it.
Right. It's a comfort thing. Between age 30 to like 60s, we could recommend a PAP every 3 to 5 years, depending on your risk, your history. If you've been married and you're with the same partner and nothing else has changed, you're not having any complaints, we would say about every 3 to 5 years, right? It can be unnerving because all our lives we were told we need a PAP every year, right? But we know more, and also we know your risk, right? And we talk to you about that. And certainly if someone said to me, you know what, I would really feel more comfortable getting it every year, I would probably do that every year.
Yes, because I was just shocked because I'm like, okay, this would probably be year 3. So maybe I'm up next year or maybe the 5th year. But
yeah, every 3 to 5 years.
But I did read somewhere where it says that the cancer with cervical cancer, it grows. It's not a fast growing cancer. So it may go 10 to 15 years. It's sitting back there growing before you even get symptoms. So if you are going to the doctor every year, women, to get your wellness woman check, your annual exam, then the doctor should be able to see something if they're doing the pap smears within that.
Yes.
Because that's a long time.
Yes, that is a good point because cervical cancer is a slow growing cancer. And before the cancer cells become cancerous, we can find precancer cells on your PAP exam. And if we find precancer cells, your gynecologist can do different sort of local procedures to remove that area that has the cancer and the abnormal cells, because good thing about most tissue can grow back, right? So even if we had to remove a piece of the cervix that had precancerous cells, it all grows back, that the body is a wonderful thing. But that is why no woman should ever die from cervical cancer. If you are getting your PAPs every year, every 3 to 5 years, right? We should be able to catch things early, because even when it becomes cancer, if it's localized, there's surgical procedures, and it's usually better treated with surgery, a surgical procedure, either removing the cervix, hysterectomy, depending on where it is and how large it is. But then
And
there's also chemo and radiation.
localized means it hasn't moved outside of those tissue walls. It's just in
That's right.
that one spot.
Yep. And we want to catch it localized, because that's when you can do something surgically to remove it, and the problem should be, gone. It's when it's in the lymph nodes, or when it seems to have spread, even if it's, touching your bladder or touching your colon, then it could be spreading.
So when women have to get a hysterectomy, or you hear people, oh, I had to get a hysterectomy, or they had to get some parts removed, does that mean that it wasn't local anymore? It moved outside?
Not necessarily, right? So the gynecologist would discuss size, location, what is your risk of this cancer recurring, right? And gynecologists will always say to some that if you're not using that uterus for babies anymore, it's probably best to remove everything, right? Because there's also risk of uterine cancer, cancer of the uterus, as we get older, right? As we get older, that's the risk. And so we might say, hey, we could decrease all that risk by removing the cervix and the uterus. But that also depends on a conversation with your doctor. What do you want? And what do you feel most comfortable with? It's kind of like when women get breast cancer, right? And they might say it's localized to this breast, but we could, because of the risk, if it's depending on the type of cancer you have, your family history, we might remove both breasts to remove your risk, right? So same thing kind of goes with cervical cancer and uterine cancer.
Wow, that's good information to know. I want to take a quick break, and I want to highlight my spotlight community service person of the week. And this is going to be My Timeless Bouquets. And this is Dawn. She is a breast cancer survivor. She's very creative. She does the inspirational pillows, and she does the bouquets. She made me a bouquet for my event in October, a very pretty bouquet. And she does a lot of things when it comes to breast cancer survivors, just donating, just everything from anything that you want. She has it. She donates bags, makeup bags, cards, like anything. You could just go to mytimelessbouquets.com and make sure that you tell her that Warriors Talk sent you. Very, very unique work that she does. So that is our community service spotlight. Make sure y'all go to her page, please. She's on Facebook, and you can also go to the website as well. We are live on Intellectual Radio, and we're talking about cervical cancer, what every woman needs to know. And Doc Michelle never disappoints. She is really breaking it down for us. I wanted to jump into and talk about some of the risks that some women may face as it relates to cervical cancer.
Yes. So you mean the risk being sexually active in itself is a risk? Having multiple partners is a risk, right? And those, when you think about who's going to get cervical cancer, it can be anyone. But once you become sexually active, and I wanted to touch on males too, because they can get HPV virus as well. So being sexually active, having multiple partners, engaging in high risk activity, and also, like if you are HIV positive, that also can put you at risk, because your immune system, when your immune system is low, you're more at risk for advanced disease.
Paula said that's what happened to her. She got really sick. Oh, I didn't even know that. Kenya is commenting about Dawn. She is amazing.
Oh yeah, that was beautiful.
She really is. So we're not saying that this is just something that women can pass, but it's also something that men can get as well. So they're not exempt, even though they're cervix.
Yes, they can get penile cancer, they can get genital warts, and they can get anal cancer if they're having anal activity, right? So it's important because if a young man gets HPV from sexual activity with a woman, right? Because she doesn't know she has HPV. It's, it's living in the vaginal cervical area. It's giving her no symptoms, but that sexual activity that can be passed on to him, right? He has no symptoms. Maybe he might get a wart, maybe he may not, but then he can pass that on to the next woman, right, that he may have activity with. And so it's important that the boys that are 11 to 12, just like the girls, also get the HPV vaccine.
Have you heard something about smoking, like breathing in secondhand smoke too? They said that was a risk factor.
As a risk, I did read that smoking is a risk factor for cervical cancer. And I think that is, so we know HPV is the cause of cervical cancer. But when you add in things like smoking, that causes more inflammation in our bodies in general, right? And it's what can weaken your sort of immune system, your ability to get that HPV virus and it go away, right? Versus it's there and it's sort of lingering. And because we're trying to think about, why does one person get HPV and it goes away and one person get it, right? And it lingers and causes warts or causes cervical cancer. And so, they look at which women get advanced disease versus those that don't. And smoking has come up as a possible sort of confounding reason that people can get the advanced disease.
As far as coping with cervical cancer, like some women go through fertility issues. I know this is a big thing with women, especially if you haven't had any children and then you get diagnosed.
Right. So important, because if they can catch cervical cancer early, we can do certain types of procedures that can allow your cervix to still be present and your uterus to be present so you can still have babies. We know we've got such advanced medical technologies now that we can harvest eggs, right? If you have to have chemo or radiation or something, even if someone has radiation, they can kind of pinpoint the radiation to exactly where it needs to go so it doesn't attack the ovaries, and you can still have healthy ovaries and healthy eggs. So we do have lots of great options to maintain fertility. And again, I always, and I stress that if anyone's listening and you haven't had your pap exam and your HPV testing, to go and get that done. Because that's how we can catch it early and keep it localized for those treatments.
Some people are coping with having sexual problems. It may not be the same, or sometimes it could be in your mind, the pain that comes with having cervical cancer.
Yeah, and we know that having cancer in itself, right, changes how you feel about your body and yourself, right? And then you having a gynecological cancer, which causes its own stress and pain, and like we said, intermittent bleeding and all of that. And so it's important to have a good support network, because there are cervical cancer, usually online support groups as well. And have the conversations with your provider about that. You may need to talk to someone, right? When I have a patient with any type of cancer, one of the first things I'm going to offer them is behavioral health therapy, is someone to talk to, right? Because that's also important as you go through the journey.
It's so important. Like it should
Body
come
image.
with, when you give that prescription for whatever treatment they're going to get, it should be a prescription for them to seek help as well mentally. So I totally agree with that. Dr. Shell, some people may have shame or guilt that's attached with this because it is transmitted sexually. So you figure like, oh, people gonna be looking at me funny, like I'm out here being promiscuous, but that's not true. You could be with one person and get it. You could have two partners and still get it.
Absolutely, absolutely, because there's no way to tell when someone got the HPV virus, right? Because even when we do pap exams and we do testing, sometimes we may see it on the test, and sometimes it may go away, and sometimes we might see it on a test. And so there's no guilt. And as we talked about, 80% of women have had HPV at some point in their lives, right? It's quite common, right? Where you're lucky if you don't get the sequela from it, if it comes and it goes away on its own. But the stigma and guilt from cancer in general, we know that that exists, especially when we talk about a cancer that might be linked to sexual activity, right? So we have to educate ourselves, which is what we're doing here, right? We've got to educate the public because we don't want stigma and guilt to keep someone from going to get checked out.
Absolutely. What role does family history play when it comes to cervical cancer risk, and how should women with a family history approach their health or their health care?
Right. So it's not as clear cut as we think about with breast cancer, colon cancer, right? We know if you have a family history, then you are at increased risk of getting that. It's not quite as clear with cervical cancer, because if you don't get the HPV virus, or if you get your vaccine and you never get HPV, that becomes more advanced, then you won't get cervical cancer. So there might be some little piece of family history linked to it, but it's not as much as when we talk about breast cancer and colon cancer. But we know that if we practice safer sex, use a condom, get your vaccines early in life, that your risk of getting HPV or the cancer is much, much lower.
For women, and I think you might have just answered this, for women who have had the vaccine already, what additional steps that they can take to just to make sure they are preventing cervical cancer? Like, they have the vaccine already, but is there anything additional that they should be doing?
Right. So we always say no vaccine is 100%, right? No flu vaccine, none of them are 100% at prevention. And so the other piece is, yes, you got your vaccine. That is great, but still get your well woman exams, still talk to your provider, still get your pap exams as your provider recommends, right? I had my pap exam this year. She said, I'll see you in 3 years. And I was like, oh, 3 years, really? Okay. But yeah, it's 3 years, depending on your risk. It might be every year, or it might be every 3 to 5 years, but that's still important, even though you've had the vaccine.
So even though you have the vaccines, which they should be starting at age 12?
Yes, between 11 to 12. They should be offering that. You got to take your kids to their provider and have that conversation. And most providers should be offering it to your tween around age 11 and 12 to start the series. Like we said, it's 2 vaccines, six months apart.
And so when you have sex, then you should be going to get a pap smear or 21. So if you have sex at 16, then you should be starting to get your pap smears at that time. If you haven't had sex until you're 21, then at 21, that's the age that you should start getting your pap smears and getting tested for cervical cancer. Now, do they automatically, when you get your pap smear, do they automatically test you for cervical cancer?
So in the younger population, those in their teens and 20s, for sure they check, right? Especially if they have not had their vaccine, right? As we get older, the assumption is you've probably had HPV somewhere in your life. So the most important part that they're doing is doing the pap exam to make sure that that looks completely normal. If a pap exam looks abnormal, looks like it's got some inflammation, some precancer, is it or is it not? We call it atypical. Pap exams always tend to come back with, we see some atypical looking cells. What does that mean? Is that precancerous? Is that because there's some inflammation there because I had an infection or I just had sexual activity and that's caused inflammation? So what happens in those pap exams is then there is what we call a reflex test where they will check for HPV. So it might not be routine for a 40-year-old woman's when she goes for her pap to get an HPV test with her pap. But if that pap looks at all not completely normal, it just gets an HPV test done on it, if that makes sense. Whereas when you're younger, we're checking everyone, right? Because we're really trying to make sure that they didn't just pick it up from one year to the next.
Paula was saying, is it still 2 vaccines?
2 vaccines.
So 2 vaccines, 6 months apart.
2 vaccines 6 months apart. If you're over 16, sometimes they will recommend a 3 vaccine series. We want to get most everyone done and vaccinated by the time they're 16. And so usually, your doctor should be bringing that up when you take your child for their exam every year, right? That 11 to 12, that's what, going into 6th grade, and they need that 6th grade physical. So most kids are coming into their provider office at that time, at that 12-year-old mark. And that's where we figure we'll catch them to get that vaccine.
Yes, because they do. They ask me every time I go in there, like the doctor, she will pull my older girls to the side without me, ask them questions and stuff. And then she'll ask, do they want to get the vaccine? Then she gives me information on it so I can read about it, and then make my decision. So I think it's important that the doctors are asking so that you can, and then give you the information so you can make an informed decision. Is there a follow-up to this? Like with COVID, there's so many different boosters you have to take. Is there like a booster? Is it just those 2 shots 6 months apart? That's it.
It's just those 2 shots 6 months apart. Yeah. And that should protect you from getting that virus. And again, no vaccine is 100%, but your risk. And when they look at the amount of cervical cancer that we have been diagnosing since we introduced the HPV vaccine, the prevalence of cervical cancer has gone down by about 80%, right? So we know that HPV vaccine is doing a good job in ever getting people to get HPV, because we're seeing the numbers and we're seeing that it's at least an 80% drop over the 30 years we've had this vaccine.
Yes, it says the incident rates for cervical cancer decreased by more than half from the mid-70s to the mid-2000s, largely because the increase in screening.
Yep.
And then
vaccines.
And then it also, screening and vaccines. And then it also talks about how the cervical cancer death rates have dropped because of the screening and the vaccines. But it says that the death rate for African American women and Native American women are about 65% higher than white women.
I saw that. And that is also sort of an access issue. It's a educational, socioeconomic issue. We know that the highest death rates occur in the lower income, lower socioeconomic communities. And so that is something that providers, gynecologists we have to do better at that. But, that's also because if those communities feel they don't have good insurance, they think they're going to have to pay, and we're dealing with other things, they don't go and get their PAPs. I remember when I was a resident 20 plus years ago, I had a patient who had advanced cervical cancer and passed away from it because she was in underserved Chicagoland area. She was not thinking about getting a PAP exam, just, trying to make it in the world, in her life. And unfortunately developed advanced cervical cancer and passed away from it. But that should not be happening. But we know that in the Black communities, as in most cancers, tend to affect us to a greater degree.
Yes, there's an organization out here in the Chicagoland area called Equal Hope. You can look up Equal Hope, and they do assist individuals with cervical cancer as well as breast cancer, and they help with insurance. So you don't not having insurance is not an excuse. All you got to do is make the phone call. Equal Hope,
That's right.
and they'll be
That's
able to
right.
assist you. So, Dr. Michelle, we
Awesome.
know that there are a lot of misconceptions. There are a lot of myths that are going on out here about cervical cancer. And one of them is, or you tell me, um, HPV is only common if you have multiple partners. So since I don't have more than one partner, then I don't have to worry about the vaccine or HPV testing.
Right. That's definitely a myth because we know that one partner you could get HPV from that one partner, right? So it's not again, it's doing away with the myth and the stigma that only promiscuous women or multiple partner are the ones who get it. No, anyone can get it if they've ever been sexually active one time or not, right? And again, that HPV can lie what we call indolent. It could just be hanging out, not causing a problem until it does, right? And so that's why it's important to get your screenings and talk to your provider and look for symptoms and things like that.
Another one is the infection will clear up on its own. So why do anything about it?
Right. So for most people, it can clear up on its own, but there are some that it does not clear up. And as I said in the beginning, there are some HPV strains, types, right, that are what we call high risk for developing into cancer. So we don't treat all HPV the same, right? So some people it can come and it can go, right? And some people it can cause more problems. And I always say, right, we don't know what causes one person to get it more advanced than another. But I always go back to your immune system, what you put in your body, making sure you're eating right, and not having a lot of, things that will weaken your immune system, which could make things become worse.
Hmm. How do you feel about financial toxicity when it comes to not just cervical cancer, but cancer in general?
What do you mean?
By it being costly, because we know cancer is one of the most costliest diseases out here that individuals face.
Yeah.
How do you feel about like financial toxicity as far as people not being able to go to
That's
treatment or get the treatment or pass on treatments because they don't have insurance?
yeah.
Or even if
That's
they
that
don't know.
Yeah, that's a major issue. And luckily, I mean, there are some foundations, societies that can help with that, right? I mean, the American Cancer Society and other that may have funding for that. But we also know that for your preventative screening things, insurances cover that, right? So if you have insurance, you don't have to worry that I'm going for my annual well woman exam and I have to pay a copay. That's covered, right? You shouldn't have to pay for that. So other things like if you're going for a sick visit, yes, you have a copay, but insurances now cover your preventative wellness visits, especially your mammogram, your pap exams. You should not have to pay for that. Now, the idea is because we want people to go and get them so that if something happens, we catch it early, which will decrease the financial strain. That is the hope, right? Because we know that it's the advanced stages that can be more costly, financially and otherwise. And so we stress so much cervical cancer, breast cancer, screening, early detection. It's the same thing here, right? If we can catch it early, we can do simple procedures versus something that becomes more extensive and more costly.
Awesome. So if anyone may think that they're dealing with cervical cancer, make an appointment, go to the doctor, tell them exactly what you're feeling, what's going on. So about a process of elimination, they can rule out some things, or they can refer you for for tests. And if you're at the age to where you can get the vaccine, get the vaccine.
Yep. If you're out there and you've got the tweens and the teens, and they have not, and you've been sort of on the fence about it, right? Because there's been a lot of talk about vaccines and what they can do, but this vaccine actually is very well tolerated. You might get a sore arm, not much else. And so please go ahead and get your children vaccinated. And then for us adults and older, make sure we're still getting our preventative visits as recommended by your provider.
Yes. So you can look up on the internet as far as what age you are to be able to tell what exams or screenings that you should be getting so that you know. And when you go to the doctor, normally they would prompt you and say, hey, it's time to get a mammogram, or hey, it's time for this screening, especially if you have been honest and open with them about what's going on in your family. So as patients, we play a part in our health too. We just can't leave it all up to the doctors to remember everything that we need. We have to go in there too and advocate for ourselves.
Yes, you have to advocate for yourself. If something doesn't feel right and you feel ignored, find another doctor that will listen to you, right? Because we also know that when a patient feels heard and understood, they're more likely to follow through on recommendations that we make. And so if you're not feeling like there's a connection with your provider, you have well within your right to get another one that will listen to you and do the things that you need. And certainly, as Lady ReShell said, is know what preventative things you need to be doing at different ages in your life, right? That's important.
Really quickly, Dr. Michelle, can you just give someone some advice about what they need to know about cervical cancer as we close it?
Yes, absolutely. So we know cervical cancer is preventable, treatable, curable if caught early. We have lots of great ways that we can catch cervical cancer early and prevent it with the HPV vaccine. So I can't stress enough, if you have a child that's in that age group where it's recommended, please don't hesitate to have the conversation with your provider and have them get their vaccines. We recommend the HPV vaccine up until age 26 and up until age 45 for certain populations, depending on their risk and activity. And definitely, continue to get your preventative wellness visits and have conversations with your provider. If you're having any symptoms that are not normal for you, if it's something that's new and it's persistent, we want you to go and have a conversation with your doctor. Talk to them about the vaginal pain that you have. Talk to them about the spotting that you're having. Anything that you find that is not in your norm, you should be having a conversation with your provider about that.
Thank you so much, Dr. Michelle. I appreciate you just sharing your experience and your expertise. I appreciate it. Thank you so much.
Oh, you are welcome. I'm always happy to share, the information, because we have to do that in our community to keep our communities healthy and thriving.
Absolutely. Thank you so much. You guys don't go anywhere. Again, this is Intellectual Radio, and coming up next is The People Show with Mark Wallace and Charles Thomas. As always, thank you for tuning in to Warriors Talk. I will leave you with these words of wisdom. Once you choose hope, anything is possible. Join me next Monday right here on Intellectual Radio at 6 p.m. As always, thank you for tuning in to Warriors Talk with author and founder Lady ReShell, where we are changing lives one warrior at a time.
Thank you for listening to this week's edition of Warriors Talk with Lady ReShell. To find out more about Warriors Talk, follow at Warriors Talk, the number 1, on all social media outlets, and Warriors Talk with Lady ReShell on YouTube. Please join us next week and every Monday evening at 6 p.m. Central Standard Time on intellectualradio.com for Warriors Talk with Lady ReShell, where we encourage, educate, and empower you into action.